Are you a man 45 years and above? Have you heard of a disease called prostatic enlargement or prostate enlargement? This is a disease that is found in men beyond the age of 45 years. Now, this disease has staggering percentages. Its prevalence is staggering. You're going to find that you're going to find it in 10% of men beyond the age of 40. You're going to find it in 90% of men beyond the age of 80 years, and in over 95% of men beyond the age of 90. So that means as a man ages, as a man grows beyond the age of 40, their likelihood of getting this disease is almost 95%. So it comes with the following symptoms. Listen carefully. These are the symptoms. 1, frequent urination, especially at night, what we call nocturia. Secondly, painful urination, meaning you feel pain while you're urinating in the urethra. Okay? There is a burning sensation within the urethra. Number 3, dribbling of urine, meaning the urine comes sort of slowly. Okay? So as it moves out, you can get multiple lines that are coming out because of the reduced pressure of this urine, and you realize that you have to put a lot of pressure for this urine to come out. Number 4, it is what we call incontinence. What is incontinence? Incontinence is urine passing on its own. It just comes and passes, meaning there is no control along the sphincters, meaning when the urine comes, it just passes. And then lastly, it is the blockage, or what we call the bladder outlet obstruction, where someone cannot pass urine. So those are the symptoms of prostate enlargement. Here at Crest Natural Health Center, we use the state-of-the-art technology to detect this disease in men beyond the age of 40. We use ultrasound, one of the most potent technologies, to pick out benign prostatic hyperplasia. Now, the prostate is an organ that is just behind the urinary bladder. Okay? Now, this organ here is a sexual organ, meaning it releases some fluids that are necessary in the reproductive life of a man. Now, as a man grows, this prostate starts to enlarge. Now, the prostate has 3 different zones. First is the transition zone, as we are using any technology. That can be ultrasound, or it can be any other technology. It has zone number 1, the transition zone, then central zone, and the peripheral zone. So as we check the prostate, we are able to pick out all of these zones. Now, BPH, or benign prostatic hyperplasia, begins from this transition zone. So within the transition zone, we are going to have we have cells which we call the glandular cells and the stromal cells. Now they increase in number. Now as they increase in number, the size of the prostate increases. Now this prostate is in a bone called the prostatic fossa. And in between the prostate, you have the urethra passing inside of it as it leaves the urinary bladder. Because remember, the prostate is just behind the urinary bladder. So as the urethra passes through the prostate, why does it pass through the prostate? Because we said earlier that the prostate is a sexual organ. And remember, the urethra is responsible for both urinary functions and also reproductive functions, as it is connected to the testis and to the scrotum. So as it passes through the prostate, and as the prostate enlarges, it pushes against the urethra. Now this results into the symptoms that we talked about earlier. 1 is frequency of urination, especially at night. Why the frequency? It's because there is a blockage along the urethra. So as this urine comes, it cannot navigate its way outside. So when you go to urinate, you only remove a portion of the volume of the urinary bladder, or you just remove a portion of the volume of urine, and that means that after a short time, you'll still have to go back and urinate. Why? Because your body is still forming new urine. Okay. Symptom number 2 is the slow pressure or the dribbling of that urine. Why this slow pressure? Is because there is a blockage. So you have to try and push this urine, and as it comes as it comes out, it comes at a reduced pressure and with a lot of force that you're trying to put on it. Then another symptom is that painful urination. Why? Because even in a normal person, if you go to urinate and then a little urine stays in the urethra, you feel that burning sensation. Now imagine if there is a blockage, and this blockage is a permanent blockage. There is going to always be trouble, because there is always going to be a burning sensation within your urethra. Number 4 is incontinence, meaning there is no control over urine. It can be mild, it can be moderate, or it can be severe. In mild cases, you will see that when you think about urinating, you want to run to the toilet immediately, but you can't even reach there. Why? Because your sphincters are not active. The sphincters are those guards that you sort of hold when your urine is coming. They are between the urinary bladder and the urethra. So as the prostate presses against the urethra, you start losing control of your sphincters, because they are not fully involuntary and they are not fully voluntary, meaning you have limited control over it under normal circumstances. But when the prostate enlarged, you also lose that limited control and you have no control. So when the urine comes, it just finds its way. Imagine, staining your trousers, or maybe walking while smelling. These are real life circumstances that come out of this disease, and it's one of the end stages of this benign prostatic hyperplasia. Now, there's this other case where the urine cannot come out completely because of complete blockage. That is what we call bladder outlet obstruction. So at that point, you cannot urinate. You go to the toilet, you feel the urine, you feel your bladder is full, you try to pass the urine doesn't come at all. So why? Because of the complete blockage with the prostate pressing against the urethra. So do not accept to wait. Come for a checkup. If you're 40 years and above, come for a checkup. If you have those symptoms, come for a checkup and get treatment from Chris Natural Health Center. Now, at Chris Natural Health Center, we have an array of experts that treat this disease. Okay, we use homeopathic medicine, an alternative form of treatment where you don't have to undergo surgery as it is known. We treat you without actually going through surgery, and we are one of the few hospitals in Uganda and in East Africa at large that can actually treat this disease without surgery. So please come to Chris Natural Health Center, Kayaza Road, Lutete, 8 miles from town, opposite Vision Petroleum. You can call us on our phone numbers. Please comment. We are ready to answer your questions about this disease. Or if not, you can visit our website at www.chrisnaturalhealthcenter.com to learn more, or even book an appointment to see an expert. My name is Mubarak Wantimba. I'm a medical imaging technologist, someone that is responsible for using technology to check for the different diseases in the body. Thank you for listening, and I'm waiting for your comments, your phone calls, and also to see you here at Chris Natural Health Center.